It's day 26 of the government shutdown, which is the second longest in U.S. history. And it all hinges on whether lawmakers can reach an agreement on health care subsidies. Now, Democrats want a bill that extends tax credits for health insurance under the Affordable Care Act. Right now, Republicans are refusing to extend those credits, which will expire at the end of the year. And if those subsidies do expire, and because President Trump already made cuts to Medicaid earlier this year, insurance premiums will skyrocket for millions of Americans. And you know who will feel the brunt of it? Women. Reports show Medicaid has been one of the most important pillars of women's health coverage over the last 15 years. Last year, nearly 24 million women aged 19 and older were enrolled in Medicaid. It funds more than 40% of all births, making it the largest single payer for pregnancy-related services in the U.S. Over half of these Medicaid-funded births happened in just 4 states: Louisiana, Mississippi, New Mexico, and Oklahoma. And that's according to the Kaiser Family Foundation. 2 of those states, Louisiana and Mississippi, also have some of the highest maternal mortality rates in the country. More than 2,300 mothers die during childbirth each year in just those 2 states alone. And for context, countries like Iceland and the United Kingdom had a maternal mortality rate of 0 in 2022 and 2023. The U.S. as a whole stands out with one of the highest maternal mortality rates among high-income countries. Medicaid expansions have helped to slightly combat this crisis. The expansions have been linked to a 17% drop in hospitalizations during the first 60 days postpartum, according to research from Brown University and NYU. But defunding Medicaid is expected to reverse this progress, worsening the maternal mortality crisis across the U.S. as mothers lose access to care. Joining me now is Dr. Joya Crear-Perry, OBGYN and founder and president of the National Birth Equity Collaborative, and Tatiana Ali. You might recognize her from her iconic role as Ashley on The Fresh Prince of Bel-Air, among her other roles as an actor. But she is now a maternal health advocate after her own traumatic birthing experience. Good morning, and thank you to you both. Tatiana, I want to start with you. As you know, Black women have higher maternal death rates than any other racial or ethnic group in the United States. Most of these deaths, however, are preventable. But racial bias in healthcare continues to put Black women in danger. Can you talk about your own experience and how this led you to be an advocate in the space right now?
Yes, I can. And I was able in, I think about 5 years ago, Dr. Perry, to testify in Congress about my experience. I had a very healthy pregnancy, and that all changed when I got to the hospital. I experienced obstetric violence, and that led to my son being in the NICU for 4 days because of the traumatic nature of his birth. That was completely unnecessary. And when I became pregnant again, I was overjoyed and also terrified that I'd experienced the same thing. And that's when my journey into advocacy and really learning about the reproductive justice movement began. The reason I mentioned Congress is because I was there with these brilliant doctors, with Charles Johnson for for Cure for Moms Foundation, with both the needs and the solutions so clearly on the table. And you know, even 5 years ago, 6 years ago, I watched that conversation devolve. There's so much that needs to be done. And what's happening now is not it.
Dr. Perry, there was a lot of conversation during the prior election cycle about reproductive freedoms. And gradually that conversation evolved into one being about reproductive justice as well. And Tatiana has sort of just scratched the surface with what that conversation is, particularly its focus on Black maternal issues. And the Black maternal mortality crisis makes this potential issue around Medicare expansion or Medicaid expansion particularly relevant. In 2021, Medicaid essentially accounted for 64% of deliveries among Black mothers. And it seems like the very Medicaid cuts that Republicans are now attempting to roll back were part of the solution in lowering the nation's maternal health care or specifically racial inequities. How do you justify that or juxtapose that, reconcile that in this conversation around reproductive justice?
Thank you so much. Really, it's hard to reconcile it at all, considering the fact that one of the times that I was able to testify before Congress was in 2017 when Donald Trump was the president before, and he passed a bill. He signed it into law to come, which we couldn't get passed for many years, to count the maternal deaths in the United States. The CDC got funding to give to states. So he understood something in 2017 that he clearly has forgotten at this point, that when we don't invest in the health care for our mothers, that we are dooming them to death. And that we don't even count the deaths at this point. But places like Texas and Georgia are not even going to count the deaths this year. They are aware that their deaths are getting worse, and they're just refusing to look at it. So there's no way to reconcile the reality between the fact that he understood these things in his previous presidency, and he currently does not.
Tatiana, I recently had a conversation with a friend who told me, and I'll never forget this, that a black woman is no more closer to death than when she's about to give birth. And that was such a sobering statement to think about. Why are so many black women dying during childbirth in a country that is a world leader in science and in medicine?
You know, when I share my story, I always say that my story is one drop in a bucket that has been overflowing for a very long time, for generations. So there are historical reasons. We're not listened to. More and more, we have maternal deserts in this country. There is a bias. We all have needs as human beings, especially during labor and pregnancy and postpartum. Some of us get our needs met and some do not. And it's that not getting our needs met and being vilified for even having those needs. That is the problem. But I always make sure to say in my advocacy that there are incredible birth workers around the country who are doing the work to take care of us, who are doing excellent work and who have the numbers, and they need our support and their guidance. Even now, as SNAP is about to expire and people are going to lose their benefits. I mean, you want to talk about something that mothers need, pregnant women need, pregnant people. They need food. They need nutrition. Our children need nutrition. We are the ones who are going to be at the food banks. We are the ones who are going to be calling up organizations and knocking on neighbors' doors, looking for ways to take care of our families. So always look towards each other. I mean that the solutions and the answers are there, and we have to help each other at this point.
Dr. Perry, Tatiana just mentioned the notion of maternal deserts, and you have a particular spotlight on states like Louisiana, Mississippi. There are higher maternal mortality rates there than entire nations. What do you think contributes to the particularly high rates there? Is it a lack of concern there? Is it systemic racism? Is it some combination of all of the above? Like, why there are we seeing this spike?
Yeah, I mean, I think it's both of what you just said. It is a structural racism, sexism. So you add being both Black and a woman, you get the worst rates in the industrialized world. We have worse maternal health outcomes in the United States for Black women than they do in Lebanon right now. I was at the UN back in April, and the health commissioner there was talking about their maternal death rates, and they're in the middle of war. They're taking in people from across the Middle East, but they actually care about those people. When you don't care about people, when you don't value them, you don't provide respectful care, you don't invest in them, you see that we will die, that we will not be able to survive in childbirth. I just want to build on something that Michael Cohen, who was your previous person, said, because it matters here. The words that are coming out of me and Tatiana's mouth sound very differently to you than they do to a person who doesn't want us here. They enjoy the fact that we are dying. They get a pleasure from when we say that we are less likely to survive. Eugenics is real. White supremacy is real. We see that people are being hunted who are immigrants, mothers who are coming from other countries. All those things are real things. So to act as if we're living in Pollyanna, as if there are people who see Tatiana and I and you and do not wish us to be on this TV, do not wish us to exist, would be us being ignorant to the truth. So the truth is, yes, I know I appreciate you are having us on to have this conversation, but there are people who are here speaking right now who want us to stop talking and want us to continue to die in childbirth.